Hi, Casey.
Hi.
Welcome in today.
Thank you.
My name is Kate C. I'll be taking care of you today for our chiropractic exam.
Okay.
I read on your chart that you've been experiencing some pain and tightness.
Yes.
Can you go ahead and tell me a little bit about that?
Yes, I have been having a lot of upper shoulder area tenseness. It's really extremely tight. I feel like I try to adjust, stretch, and it just doesn't help. It feels like my muscles are pulling.
Okay.
No sharp pain or anything.
Okay. And how long have you been noticing this tightness?
Oh my gosh, probably a month now.
Okay. Does it get better or worse when you sleep at night or you exercise?
Worse, yes.
During when you sleep and exercise?
Absolutely both.
Okay.
I wake up and it's hard to move my head.
Okay, that definitely is not what we want.
No.
So we're going to go ahead and take care of you today.
Thank you.
We're going to go ahead and do a classic long exam today to first assess the tightness and areas of tightness, and then we're going to move on to a treatment regimen.
Absolutely.
Okay,
Thank
great.
you.
Of course. First, I'm going to go ahead and start by assessing your gait as you walk. So I'm going to go ahead and ask you to stand on the floor and just walk across the room.
Okay.
All right, great. You can go ahead and just come towards me here slowly. Okay, perfect. I'm going to trade places with you. And you can go ahead and turn towards me and then walk towards me one more time. Okay, one more time. I'm going to have you turn around and then come towards me. All right. Now I'm going to go ahead and touch you. Is that okay?
Yes.
Okay, great. It seems like your legs are in really good alignment just from the way that you're standing, the posture you have, the way that you walk. The hips don't feel too tight. Nice balance between each foot, which is a good sign. I can tell though that there is some tightness in the shoulders, as you mentioned. Just by the way that they're resting against each other. Move your hair to the side. Assess the neck. Can you feel that stiffness now?
Yeah.
Okay. Any pain in the wrists or ankles?
No.
Just going to ask you to turn towards this wall here and just going to feel the different vertebrae in the spine. Okay, I'm going to have you put your arms out to the side in a T position. Perfect. Okay, now I'm going to have you put them out in front of you. Yes, Okay, and once more, straight up over your head. Perfect. Okay, great. You can relax your arms. Now I'm going to go ahead and take a look at your feet while we're standing here.
Okay.
Go ahead and continue to stand there and remain comfortable. I'm just going to take a look at your legs. Feeling the muscles. And assessing the hips as well. Okay, same as my thoughts earlier. It seems pretty even here with the weight distribution between the 2 feet. The muscles seem pretty identical on both sides. I am going to ask you to put your weight on your right foot. Raise this left foot up. I'm going to go ahead and put a block underneath you. You can go ahead and just press some weight down on that block. I'm just going to see how the hips, knees, and ankles adjust to this slight change in posture. Is there any pain here?
No.
I'm going to ask you to shift your weight back onto this right foot. I'm going to do the same thing on the other side. Perfect. Now you can press your foot down on that block. Great. No tightness that I can feel in the hip flexors. The muscles are not overcompensating for any uneven weight distribution. Ankles appear healthy as well as the knees. No pain in bending. Okay, now I'm going to go ahead and remove the block. Perfect. Everything is looking great from the lower body down. I can see how everything is even and aligned from the spinal column all the way down through the bones in the legs and down to the ankles. I'm going to go ahead and switch to the upper body and ask you to sit back up on this table for me, please. Okay. All right, Casey, we're going to continue, but switching to the upper body this time. I'm just going to gently position you. Feel free to relax. Just going to take a look at the muscles, how they interact with each other on a more closer, more specific angle. Does this cause you pain in the stiffness around your neck?
It feels like a pinch.
Okay. I'm going to have you lower this down now. I'm going to take a look at the elbow joints. Any pain upon bending?
No.
Okay. Just going to slowly bend and feel how the joint works. Okay. Moving on to the wrist. Can you flex your hands out like a starfish almost? Great. Now clench them into a fist. Any pain with this motion?
No.
Okay, go ahead and relax. I'm just going to bend your wrist back, flex it forward, Any pain here?
No.
I'm just going to take a closer look at the joints and the fingers. Any pain here?
No.
Okay. Just going to gently tug on each finger. See how the joint responds. Okay. And gently put it back down. I'm going to go ahead and move to the other side. Okay, I'm just going to transfer your hair to the other side here. Same things on this side. Gently raise your arm up. And bring it back down. I'm going to take a look at the elbow joints. Okay. I'm just going to slowly bend and feel with my right hand how the joint responds to the fluidity of this movement. And one more time. Did this cause you any pain? No. Okay. Moving on to the hand. I'm going to take a look at the wrist. Move it in both directions. I'm going to ask you to sprawl out your fingers like a starfish, close into a fist. Does this cause you any pain?
No.
Okay, great. I'm going to move each finger. And just wiggle each joint, feel how it responds. Okay, great. Now we are going to do some stretching techniques. This is going to help loosen up the shoulders, but also to help me test the alignment of the body. So far everything looks good, but we are just going to do some basic, simple stretching. I'm going to have you scooch a little bit farther back on here. I'm going to start with the butterfly position. So feel free, if it's comfortable, to bring your ankles touching each other. Okay, perfect. Perfect. I'm just going to gently push on the leg here. Does this cause you any pain?
No.
I'm going to move to an assessment of this side. Gently pushing the knee down to elongate the stretch. And both at the same time here. Okay, now we're going to go ahead and stretch along this side here. So I'm going to have you raise your right arm over your head and lean as far as is comfortable. Great. Perfect. All right, you can relax. And we're going to do the same thing with the other side. So go ahead and take your left arm and go ahead and reach as far as is comfortable. Great. Okay. And you can go ahead and relax. I'm going to ask you to bend forward as far as is comfortable. Don't worry, the table is very stable, so you can put your weight however you want. But go ahead and drop down as far as is comfortable. Great. Just going to feel the vertebrae. And you can go ahead and sit up and relax. All right, I'm gonna have you adjust yourself a little bit. You can go ahead and scooch over here and bring the legs up on this side. Perfect. All right, Casey, we are going to focus on stretching the spine now. I'm going to ask you to bend forward and try and touch your toes without hurting yourself, but as far as is comfortable for you. Go ahead and hold this position for a minute. If it becomes too painful, you can back up a little bit, but I am going to be taking a look at the spine. All right. I do have an acupuncture tool with me here. I'm going to be feeling the vertebrae on the spine and assessing how they stack against each other with my acupuncture tool here. This shouldn't be painful, but let me know if it causes you any discomfort. Along the sides of the spine, seeing how the skin and the muscles underneath interact. You can definitely see the tightness in this area between the vertebrae, but more especially between the muscles. Stretching back while you're in this position. I'm just going to gently use my acupuncture tool to assess how the muscles respond to some tension. Okay, you can go ahead and sit up and relax. You are extremely flexible, which is always a good sign, and it definitely helps the muscles and the joints of the body as they interact with each other. going to try something a little bit different now by focusing on the flexing of the foot. Okay, so I'm going to gently wrap this around the foot here and ask you to hold on to these so that you are able to stretch however is comfortable for you. Go ahead and tug on these and have the foot flex back. Great. And lower this just a little bit. Great, and pull back. Okay, great. Does this cause you any pain?
No.
Can you feel the stretch?
Yes.
Okay, great. Everything looks good. I'm going to ask you to relax, and I'm going to move this over to the other foot here. And go ahead and tug that foot back, elongating the stretch. You can feel it in your calf. Okay. And you can relax. You can take this back. Perfect. Now we're going to move on to the next phase of our assessment. I'm going to ask you to lay down with your head at this end and your feet at this end.
Okay.
Okay, perfect. I'm just going to gently press down on your shoulders here, creating a little bit of a stretch. It shouldn't be painful though. Okay. I'm going to assess the hips in this different position. Assess the collarbone. I'm going to go ahead and stretch out the back of the spine. I'm going to ask you to give yourself a hug here with your arms, just gently wrapped over your chest like this. I'm going to have you bend this leg so that your heel is where your knee is. Perfect. And then I'm going to ask you to slowly fold yourself over onto your side so that we're stretching the hips. And as that happens, I'm going to just gently elongate the spine. Okay, perfect. We're going to do the other side now. I'm going to have you relax this leg. Bring this leg over to this side. Go ahead, and I'm going to gently elongate the spine here. Okay, perfect. I'm going to have you relax back into resting, and I'm going to have you actually turn over onto your stomach now. We are going to go ahead and do a stretch of the lower back. Go ahead and bring your hand over to rest on your hip and turn the body as much as is comfortable for you. Perfect. How does this feel? Great. Now you can go ahead and switch over to the other side by bringing your hand around. Great. And cracking. Oh, perfect. Great. Now you can go ahead and arch your shoulders up, rotating the shoulders as is comfortable. Lovely. Go ahead ahead and bring your ear to your shoulder as is most comfortable. Perfect. Feel free to adjust this position, however best elongates the stretch for you. Great. And the other side. Perfect. Great. Now before we move on, to further elongate the stretch, you can bring your right hand up almost by your ear and pull the head towards that shoulder. Great. And relax. Now you can use your other hand. Perfect. Okay, great. Now you can go ahead and switch to your stomach.
Awesome.
Continue to relax, Casey. I'm going to be doing some measurements here with my measuring tape between the vertebrae. I'm first feeling them with my fingers, and then feeling how the measurements lay out. Just going to gently sweep your hair to the side. Alright, Casey, I do feel that tightness that you were mentioning in the upper body. It is the shoulders as well as the neck. I do have a massage gun tool here. I'm just going to put it on the lightest setting. Let me know if it causes you any pain or discomfort. Now I'm going to move on to using a few other massage tools to help loosen that tension. Now that we've helped loosen up these muscles a little bit, I'm going to go ahead and do an adjustment on the spine. I'm going to ask you to take a deep breath in and exhale. I'm going to do this one more time. Deep breath in and exhale. Great. I'm going to have you raise your head just a bit so I can gather your hair. I'm going to use a bit of oil, and I don't want any of it to get on you. Okay, and go ahead and relax. I don't want any oil getting onto your hair, so I have a little cloth towelette here. I'm just going to lay here, pushing the hair back. I'm going to combo that eucalyptus massage oil with these massage bars from Lush. Now I'm going to use these heated massage stones to gently press into the skin and help to massage that tissue. I'm just going to gently massage the muscles. You can feel them slowly loosen in their stiffness and tension as I continue to work the area with my hands and the various tools I've been using. I'm going to gently use this massager tool to continue to work at loosening all the tension in the area, as well as down the sides of the hips. Another wooden massage tool here. This one's a bit rougher on the skin, so I think too hard for the delicateness of the shoulder area. I'm going to go ahead and use it on your leg as well. Alright, Casey, I'm going to go ahead and gently use this ball massage roller to continue to loosen everything up. Let me remove the towel now that the oil is set. I'm go switching back over to my hands here. back onto your back. Alright, Casey, I'm going to make some slight adjustments to your neck. Feel free to just relax while I gently loosen the columns of the spine here. I'm going to have you take a deep breath, and then I'm going to turn your head to the left for an adjustment. Great. And exhale. Perfect. I'm going to do the same thing, but to the other side. Go ahead and inhale. Great. And exhale. Perfect. Go ahead and stay here. I'm just going to briefly relieve some tension around the collarbones. Gently massage. And I'm going to take a look at your feet now. Alright, so I'm just going to put on some gloves. I'm going to gently remove your socks here so I can take a look at the feet, the joints of the toes. Checking how the feet rotate as I gently move them. I'm going to ask you to bring your toes towards your chin and point your heel. Great. And relax. Does that hurt at all?
No.
Okay, great. I'm just going to gently move the feet side to side. And point your toes towards your chin. Great. Does this hurt at all?
No.
Alright, great, and relax. I'm going to give the feet a little bit of a massage. I do notice some tension here. Everyone has a decent amount of tension along the feet just from daily walking. Alright, I'm just going to gently tug on the sockets of the toes, gently pulling. And gently pull on one leg at a time. Go ahead and relax. Let me hold the weight of your foot. I'm just going to gently tug and release. the other side. Go ahead and relax. Let your weight fall into me. And just a gentle tug. Okay, we're going to do both at the same time. Go ahead and relax. Perfect. Great. Wonderful. I'm going to go ahead and hand your socks back to you and ask you to stand so we can complete our assessment.
Okay.
All right, Casey, how do you feel after our session today?
Way better, yes.
Lovely. It was a pleasure working on you today. I definitely noticed you had that tension, especially around the shoulder blades, the neck area, the shoulders. And as we worked today, I was able to feel the tension slowly begin to ease.
Yes.
I would recommend routine chiropractic adjustments as well as massages to keep that tension at bay, but it is drastically improved.
Yeah.
Just to compare again from the start of our session today, I am just going to have you go ahead and hold your arms out in front of you. Great. Yeah. You can really feel the tension has eased. All the muscles are supporting the arms. The tight rigidness is eliminated.
Yes.
Go ahead and raise them above your head. Great. And relax. Great. Everything seems like it's been very improved in our session today.
Yeah.
So I'm really happy that you were able to come in, and I would love to get to work on you again soon.
Yeah, thank you. It feels really nice.
Of course. I'll see you again soon.
Okay.
Bye-bye.
Bye.
Right. Both. Now. 3, 5, sharp, dull, cold, blur. Center. Left. Left. Hi Casey, welcome in today. How are you doing?
I'm okay. How are you?
I'm pretty good. Thank you for asking. We're going to get to the bottom of why you've been feeling a little bit rough today. As you remember, I am Dr. C. I'll be taking care of you today. I see from your appointment booking notes that you've been experiencing some issues. Go ahead and just tell me a little bit about that.
Yes, I have been having some sensory issues.
Okay.
It's my leg. I have this bruise.
Oh, yeah.
And I don't know where it came from or what happened, but it feels a little numb in areas.
Okay.
And then I get like a pinch in my knee, so I don't know if it's related or not.
Okay. Give me 1 second to just jot this down. The bruise, I'm just measuring it. It's about 1 inch in either direction. I'm just going to jot that down. And when did you first notice this bruise appear?
The bruise was about 2 weeks ago.
Okay. Same for the pinching in your knee.
That was only about a week ago.
Okay. The pinching in your knee, does it bother you when you're sitting completely still, or is it something that flares up while you're walking or bending or going up and down the stairs?
It's when I'm walking and I'm bending my knee.
Okay. Have you been experiencing any other symptoms that could be related or unrelated to these?
On top of my my head, no, I don't think so.
Okay. All right. And I'm just going to go ahead and update your chart here. Have you had any new allergies develop in the last 6 months?
No.
Have you been out of the country in the last 6 months?
No.
How's your sleep patterns been lately?
Irregular.
Once you're laying in bed with your eyes closed, do you have a hard time falling asleep? Or is it making the time to go to bed early that's been making them irregular?
Yeah. Making the time.
Have you been experiencing any headaches or tension in the body?
Tension. Yeah. I would say upper body usually.
Okay. Just add a few more details here. All right. Taking everything into account here, it does seem like a full head to toe is going to be the course of action to take today. You're due for your annual physical anyway, so I think we're just going to go ahead and cover the whole body in a really slow and detailed session today.
Yes.
We'll be sure to be gentle with your knees to not cause you any additional pain. Is there anything else you'd like me to know?
No, I don't think so.
Okay. Then we're just going to go ahead and get right into it.
Okay.
I'm going to set down my clipboard and then we're going to do your vitals.
Okay.
I'm going to begin by listening to your heart. Just going to gently move your hair out of the way. Gently move your hair. And with the bell side. Alright, I'm hearing S1 and S2. No S3, no S4. While I'm here, I'm going to go ahead and listen to your lungs as well. Go ahead and inhale. And exhale. Okay. And again, go ahead and inhale. And exhale. Okay, good. The lungs and heart are sounding healthy today, which is definitely a good sign. I'm going to move on by doing the oxygenation. And ask you to show me your finger. Perfect. I'm going to go ahead and relax it against my hand. Okay. Great. 97 with room air. Perfect. Going to go ahead and take your temperature as well. ahead and lift up your tongue and close. Just gonna take it a second. Just thinking. Just continue to relax and breathe normally. It's not beeping, which it's at 36.5 degrees Celsius, but it's not beeping, which is supposed to finalize that. So I'm gonna set this aside and, well, we are going to try using this one. Okay. I'm gonna try scanning your forehead here. 98.5. Perfect. And now we are going to do blood pressure. Is the right arm okay for you today? Yes. Alright, I'm going to go ahead and hold this. Blood pressure is reading normally at 102/90. I'm just going to gently remove the cuff from your arm. I'm putting on some hand sanitizer and this. Rub in. I'm going to gently take a look at the face and do some general palpations, feeling the lymph nodes. Lymph nodes do feel a tiny bit swollen. Alright, we're just going to go ahead and complete some range of motion tests while we're here. I want you to look up at the ceiling with your head. Great, and look down at the floor. Great, and turn your head all the way to the left and all the way to the right. Great. I want you to go ahead and relax, face center. Take your right arm and hold it straight out in front of you. Perfect. I'm going to go ahead and try and press you up. Don't let me do that. Great. Relax. I'm going to go ahead and press you down. Don't let me do that. Great. Go ahead and squeeze my hands. Great. And you can relax. We're going to do the same thing with the other arm. Go ahead and bring it straight out in front of you. Okay. Okay, go ahead and try squeezing my hands. Okay, perfect. I'm going to go ahead and press you down, so let me do that. Relax, and I'm going to try and press you up, don't let me do that. Okay, and relax. Can you take both arms and put them directly over your head? Can you circle your wrists in a clockwise motion? Great. Go ahead and relax your arms now. Can you take your feet and point them straight out in front of you? Yep. Can you swirl your ankles in a circle? Great. And go ahead and relax. Can you go ahead and take each of your hands and add fingers until you have 5? Yes, perfect. Okay, great, and relax. One more thing, I'm going to go ahead and test your chin. I'm going to go ahead and try and pull your face towards mine. Don't let me do that. Great, and relax. I'm going to push your face away from mine. Don't let me do that. Okay, and relax. Okay, great. Range of motion is seeming good. Did any of those exercises cause you any pain?
Just this one.
Okay, on your knee.
Yeah.
All right. We are going to go ahead and move on to looking at more of a cranial exam. I'm going to ask you to lay down with your head on this side.
Okay.
All right, Casey, are you comfortable?
Yes.
Great. I'm going to put on some gloves. Alright, now that you're lying down, I am going to gently palpate the face again, doing a little bit more thorough examination this time. Feeling for any lumps or bumps beneath the surface of the skin. Feeling down along the sides of the neck. I do feel those lymph nodes as slightly swollen again. Nothing massively concerning. Just a little bit of extra tenderness in that area. Feeling down along the collarbone. Normal bone structure. Feeling along the upper arms. No signs of any internal masses or swelling. Just reaching down along the arms here. Going with a slightly firmer touch to feel how the muscles react to a little bit of force. Everything is moving as it should be. I'm feeling along the hairline towards the top of the skull. Gently moving my fingers lines and circular motions to feel for any abnormalities beneath the surface of the skin. I'm not sensing anything abnormal. The skull is strong and spherical. As I gently move the skin of the scalp, everything is moving as it should be, no resistance. Now I'm going to take a focus on your ears today. I am going to insert the otoscope and take a look in the ear. Okay. Everything in the ear canal seems healthy. There's no signs of any discharge, any irritation or swelling. Nothing runny. Everything seems dry, healthy amount of earwax. I'm going to ask you to gently turn your head to the left here for me. I'm going to reposition myself to look in your other ear. Okay. Everything on this ear is seeming similar to the last. Healthy amount of earwax. No signs of any discharge, redness, swelling. Everything is looking healthy. Great. I'm going to have you rest your head like this. I'm going to set that aside for a moment, and we are going to do some hearing tests. The first one is going to be a whisper test. I'm going to whisper something into your ear, and I want you to repeat it back to me. Move to your other ear over here. Bridgerton season 4.
Bridgerton season 4.
Okay, great. It seems like everything is functioning well in both ears, but we are going to conduct a few more tests. I do have these egg maracas here. I'm going to go ahead and move them on either side of your head. Let me know if you're hearing them from the left, from the right, or both.
Left, right, both, right, right, left, both, left, right, left, right, right, left, both, 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 left, left, both, right, both, left, right, right, left, both, right, left, both, right, left, both, right, left, both, right, left, left, right, 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 both. Great. I'm going to set these aside. Now I have 2 water globes with me. They make a fun little aquatic sound. I'm going to have them on the left and right sides of your face. We're going to be doing something similar, but it's going to be distance-based. So I'm going to play a sound on your left and then on your right. And then you're going to tell me which of them is the closer sound. Sometimes they will both be close. Sometimes they'll both be far. So you're either going to say left or right. You're always going to be looking for the closer noise, unless they are equally the same, either close or far, and then just say both. Okay. Left. Right. Both. Right. Left. Right. Both. Both. Right. Right. Left. Right. Both. Both. Left. Right. Left. Both. Both. Left. Left. Right. 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 Left. Left. Right. Both. 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 Left. right, right, right.
Okay, great. I'm going to set both of those aside for now. One more test I'm going to do. I'm going to be testing the reaction of how soon you are hearing the noises that you are hearing. I'm going to make a little flicking with my left hand and my right hand. After you hear the noise, I want you to say now. 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 Good. I'm satisfied with your hearing tests today. Everything is coming back normal as far as hearing goes, which is always a good sign. We are going to move on to the eyes. I want you to tilt your head back a little bit if you're able to and open your eyes. Okay, I'm just going to shine a light to both pupils. Okay, they are round and reactive to light. I want you to follow my pen with your eyes, not your head. Okay, great, and relax. I do have a chart here. I'd like you to hold this up with your left hand if you're able to. Great, yeah, that's an appropriate distance. I'm going to point to a row, and I would like you to read that row for me. We're going to start on this row, starting from the left and moving to the right.
E, P, T, Z, O.
Great. We're going to do this row, starting from the right and moving to the left.
S, B, J, H, D.
Great. And what letter is this?
F.
What letter is this?
H.
What color is this?
Red.
What color is this?
Green.
Okay, we're going to continue, but I am going to cover up this right eye. Go ahead and read this row for me, starting on the right and moving to the left.
H, P, F.
Great. Starting this row on the left and moving to the right.
E, P, T, C, O.
Great. And what letter is this?
T,
What letter is this?
C.
What color is this?
Green.
And what color is this?
Red.
Great. I'm going to do the same thing, but with me covering up your left eye. Go ahead and read this bottom row, starting from the right and moving to the left.
H, P, F, T, L.
Great. We're going to read this row, starting from the left and moving to the right.
C, F, D, H, J.
Great. And what letter is this?
L,
What letter is this?
E.
What color is this?
Red.
What color is this?
Green.
Great. The eyes are looking good. One more visual test we're going to do today. I'm going to have a finger held up in front of you. I'm going to display a number of fingers held in the air. I want you to let me know how many fingers I have.
1, 2, 3, 4, 5, 2, 5, 1, 4, 3, 2, 1, 5, 5, 4, 2, 3, 4, 5, 1, 3, 5, 1, 1, 2, 2, 4, 5, 1, 4, 3, 5.
Okay, great. Everything is looking good with our eyes. I am going to move on to the mouth and nose. Great. Clear, unobstructed, nothing wet, nothing running, looking healthy. And I'm going to have you stick out your tongue for me and say ah. Great. Looking colorful, healthy, no any signs of unhealthy discoloration, no lesions to the tongue. You can relax. Now I am going to be doing a taste test on you today. I'm going to be holding a little vial over the tongue, dropping a little drop into the tongue, and then you're going to tell me what that is. If you would just please close your eyes and open your tongue. And there. What is it that you taste?
Orange.
Going to be doing that same thing again. Go ahead and stick out your tongue. And there. And what is it that you taste?
Peppermint.
Good. Another time. Go ahead and hold out your tongue. And there. What is it that you taste?
Chocolate.
Good. And you have one more little vial here. Go ahead and hold out your tongue. And there. What is it that you taste?
Cinnamon.
Good. Now, we are going to be moving on to the sense of smell. I have similar vials. Go ahead and close your eyes. And when I tell you to, you can go ahead and breathe in. And inhale. Great. What is it that you smell?
Rose.
Good. And again, go ahead and inhale. What is it that you smell?
I believe that was peppermint.
Good. And again, go ahead and inhale. What is it that you smell?
Can we do that one again?
Yes, of course. And go ahead and inhale.
Rosemary. 3.
Good. And one more. And inhale.
Grapefruit.
Good. Alright, everything is seeming good with our senses here. From hearing to sight, to taste, to smell. You've been passing with flying colors. I am going to move on to some sensation testing in the face. I have 2 instruments with me here today. One of them is sharp. The other is dull. I'm going to press each of these into your skin, and you're going to let me know which one it is that you feel. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Okay, good. Next, we are going to be doing warm or cold. You're either going to feel the warmth of my fingertips or the cold of the water globe. Do you notice the difference between those two sensations?
Yes.
Good.
Cold. Warm. Cold. Warm. 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 Cold. 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 Warm. Cold. Cold. Warm. Cold. 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 Warm. 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 Warm.
Okay, good. Okay, I'm happy with the sensation testing on the face. Everything is seeming symmetrical. The nerves are seeming healthy symmetrically on both sides. We are going to just continue down with our head to toe examination and take a look at your stomach. Alright, Casey, I am going to just lift your shirt a little bit. I know your pants have been adjusted, so exposing the stomach. Are you comfortable right now?
Yes.
Okay, great. First, I am going to take my stethoscope and do some listening to the sounds in the stomach. And let's move the pill side. Okay. All the noises in the stomach are sounding healthy, like regular healthy noises. I'm going to take my gloves and just gently begin to palpate the area. Moving in nice circular motions, making sure not to press too hard. Just hard enough so I can assess if there's any irregularities beneath the surface of the skin of the stomach. I'm not feeling anything. So far I am going to just do some broader strokes. Everything's feeling healthy. No signs of any building pressure beneath the skin. No blockages. Nothing like that. I am going to collect a few samples though from the skin. And start by putting a little bit of oil on the stomach. Moving that in gently in circular motions. I am going to collect 4 samples here. First one is going to be on the skin on the left side of the stomach. Just gently moving my cotton swab along the skin, putting it into the tube, popping the lid on. Next one's going to be along the center line of the stomach. I'm moving my cotton swab up and down, and then in slightly circular motions to really pick up anything in the whole area. And sealing it off. Next, I'm going to do a swab along the right side of the stomach, going in up and down in circular motions along the sensitive skin of the stomach. One more I'm going to do in the belly button. This might be just a tad uncomfortable, but I'm not pressing very hard. Just nice and gentle. Okay, we have these files that I am setting aside. I am going to move on to gently percussing along the stomach. This shouldn't cause you any pain, but if it does, just let me know. everything is sounding nice and healthy. Next, I have this feather tool with me. I'm going to rub it either on the left, the center, or the side of your stomach. I want you to let me know which side you feel it on.
Right. Center. Right. Left. Left. Center. Center. Right. Right. Left. Right. Center. Left. Right. Middle. Left. Right. Middle. Left. Middle. Right. Middle. Left. Middle. Right. Middle. Middle. Left. Right. Left. Right. Left. Right. Middle. 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 Great.
Now I'm going to be doing another sharp or dull test on you today. Let me know if the sensation you feel is sharp or dull.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. sharp, dull, sharp, dull, sharp.
Alright, great. Everything is looking good over here. I'm just going to bring your pants and shirt back to the way they were. Now I'm going to go ahead and take a look at your legs and your feet. Okay. Alright, Casey. I'm just going to take a start by finding that bruise that you showed me earlier. I do see it here. I'm just going to measure it. Alright. It's about 1 inch, like I assessed earlier. I'm just going to see. It's around 1 inch in either direction. I'm going to gently palpate the knees here. Does this cause you pain?
Only slightly.
Okay. I'm gently palpating the left knee as well as feeling along the legs. I am gently but firmly feeling my way down the legs. Feeling for any unusual bumps, any signs of any swelling, tears or lesions. Gently grasping at the skin, not too hard, just enough to assess. The muscles are feeling symmetrical between both legs. Both legs are feeling equally healthy. I do have a little tool here. We are going to do a brief sensations test. I'm going to pass it along your skin. I want you to let me know if you feel it on your left leg or your right leg.
Right. Left. Left. Right. Left. Right. Left. Left. Right. Right, left, 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 think I'm feeling it on the right, but I can't tell.
Okay. There seems to be a bit of loss of sensation on the right side around the knee area. We're just going to go ahead and continue and do a little bit more of this test.
Left. Left. Right. 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 Left. Left.
So it does look like there's a bit of loss of sensation around the right knee where your source of pain is. We are going to want to do a bit more of thorough testing to really follow up on this knee. For now though, I am going to rub some topical cream on it and wrap the knee.
Okay.
Go ahead and continue to relax. Alright, Casey, I know this might be a little bit uncomfortable, but I'm going to ask you to bend your knee. Great, so that I can wrap it. Go ahead and relax your knee. Alright, I'm going to move down to the feet. I'm going to gently remove your socks. I am going to gently palpate the feet, feeling the skin. Toes are a bit cold, but that is normal. Feeling the stability of the ankle. Those are cold on both sides. That is normal. Feeling of the lower tendons, Watching the front toe move as they should. I'm going to take a look with my light. Check out between the toes or lint. Signs of any bacteria or lint. Slight scar on the foot. That looks like that's from an old injury. Can you spread your toes on your left foot? Great. Now spread the toes on your right foot. Great, and relax. I'm going to be using this tool on both of the feet. Let me know if you feel this on your right foot or your left foot.
Left, right, left, right, 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 left, 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 right, left, right, left, right, left, right, left, 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 right, 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 left, right, left, left, right, 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 left, right.
Alright, Casey. It looks like all of your sensation tests came back really good. The only one that we had a little bit of difficulty with was the right knee area, which is not very unexpected because of the pain that you mentioned there. We are going to go ahead and schedule a few, what am I saying? Sorry, let me try that over. We are going to go ahead and schedule a follow-up appointment so that we can get a closer look at the specific knee area, but it was helpful to go ahead and take note of all of our results today to add to your chart. And we've gone ahead and rolled out a lot of possibilities, so we're just going to keep working to get to the bottom of this. I am going to let you relax here for a few more minutes, and then when you're ready, you can go ahead and dress, and I will meet you in the lobby. Thank you so much for coming in today. It was great getting to see you, and we're going to get to the bottom of your knee pain.
Thank you.
Thank you. Bye-bye. Hi, Elizabeth.
Hi, nice to meet you.
Nice to meet you too. Thank you for coming into the clinic today. My name is Dr. C. I'm going to be taking care of you today. I know that we have a little bit of dizziness that you mentioned. I'm just going to go ahead and pull up the chart here. Just need to grab a pen if you just want to hold tight for just a second. Alrighty, Elizabeth, I'm just going to go ahead and have you verify your date of birth for me.
Sure, it's April 20th.
And what's the year?
1993.
Okay, perfect. Now I'm going to have you tell me a little bit about the dizziness and what's been bothering you.
Yeah, I've just been feeling really dizzy lately, like especially when I stand up after I've been like sitting or laying down for a while.
And how long have you been noticing this going on for?
Maybe like a month or two.
Okay. Have you tried any like Tylenol, ibuprofen, anything?
I haven't, no.
Okay. Do you notice that anything you does, and is there anything that you do that improves the dizziness at all? Like if you lay down a little bit more or rest up, does it improve at all?
Yeah, resting usually does help.
Gotcha. Alrighty, I think we're going to go ahead and conduct a cranial nerve exam today just to rule out any sensory issues or anything obviously wrong. Before we get into that though, I'm just going to go ahead and update your new patient chart here by asking you a few basic questions.
Okay.
Have you had any major surgeries in the last year?
No.
Okay. Have you been on any new medication in the last year?
Nope.
Have you had any new allergies in the last year?
Nope.
Have you been out of the country in the last 6 months?
No.
Okay, so now that your chart is up to date, I am going to go ahead and begin our exam today. You can just go ahead and relax. I'm just going to start by putting on my gloves here. Okay. Go ahead and take your temperature. You can just relax. I'm just going to hold this up to the forehead. Okay, we have 98.2. That's good. Okay. We're going to go ahead and do our blood pressure test. Is the left arm okay?
Sure.
Great. You can go ahead and just relax. I'm just going to go ahead and wrap this around. I'm going to ask you to uncross your legs for me, please. Alrighty, go ahead and relax. Your blood pressure is in the normal ranges today, which is a good sign. I'm just going to go ahead and slide this off here and set this off to the side. Okay, I'm going to go ahead and do some listening to your heart. I'm just going to push some of your hair to the side for now. And go ahead and just breathe normally. Okay. Everything's sounding normal. I'm going to listen to your lungs now. Go ahead and take a deep breath in and out. Again, please. In and out. 2 more times. In and out. Great. And then 1 more time. In and out. Great. The lungs are sounding clear, which is definitely a good sign. Vitals are looking normal. We're just going to check your oxygenation really quick. Go ahead, yep, and put your finger in here. Great. Just going to give that a second to calculate. Great. Perfect. We have normal readings for oxygenation today. Set this to the side. Mark this here in your chart. Alright, Elizabeth, you can go ahead and close your eyes. I'm just going to go ahead and gently palpate the face. I'm feeling for any signs of swollen lymph nodes, any lumps or masses, bumps. I'll take a look at the scalp as well. Just feeling the head. Doesn't seem like there's anything to be concerned about today. I'm going to go ahead and take a look at your ears now. I'm going to have you turn your chin to the right so I can take a look in the ear canal. Great. No signs of excessive wax or any redness, discharge, or swelling. Everything's looking pretty healthy in there. I'm going to have you turn to your other side. Take a look in the other ear. Same situation over here. Everything is looking healthy. It's operating as it should. I'm going to be conducting a few different hearing tests for now. I'm going to have you close your eyes. You're going to hear a sound on your right side or your left side or both. I want you to go ahead and tell me which side you hear that on, or if it's both, you can say both.
Left side. Right. Both. Left. Left. Right. Left. Both. Right. Right. Left. 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 Right. Left. Both. Right. Right. Left. Both. Great. I'm going to set these aside. It's going to be the same thing, but I'm going to be snapping my fingers, a slightly more subtle sound. Left. Right. Both. Left. Left. Right. Right. Both. Both. Right. Right. Both. Left. Both. Right. Right. Left. Right. Left. Right. Both. Okay, great. Definitely sounds like
the hearing is functioning properly as it should. I'm going to go ahead and move on to the nose. If you just want to tilt your head back for me, I'm just going to go ahead and look into both nostrils. Everything is looking clear. No signs of any redness, discharge, or swelling. Nothing to be concerned about. I am going to go ahead and conduct a few smelling tests for you here. I'm just going to go ahead and hold up this vial. You're going to close your eyes and inhale when I tell you to, and you're going to tell me what the smell is. Inhale.
Peppermint.
Great. We're going to be doing the same thing, but I'm going to ask you to plug your right nostril with your hand. I'm just going to spray this substance and then have you inhale. And inhale. And what is it that you smell?
Is that tea tree?
Yep. Great. One more. I'm going to have you plug your opposite nostril now. Okay, and inhale.
Vanilla?
Yes. Great. Ready. I'm going to be taking a look inside of your mouth now. All right, Elizabeth, go ahead and hold out your tongue and say ah.
Ah.
Okay. No signs of any redness or swelling. Do you notice any discomfort in the mouth area at all?
No.
Okay, perfect. I'm going to set these to the side. Now I'm going to have you close your eyes and hold out your tongue. And I'm going to go ahead and drop a little bit of this substance onto your tongue, and you're going to tell me what that tastes like.
Okay.
Okay, go ahead and stick your tongue out. And there.
Lemon.
Yes. Okay, we're going to do the same thing again. Okay, hold your tongue out, and there.
Mint.
Great. Okay. Everything is looking pretty good so far. I'm going to go ahead and take a look at your eyes. I'm just going to have you look right here at my nose. And, yeah. Yes. Okay, the pupils are round and reactive to light. Go ahead and just test how your eyes are feeling. With your right hand here, I'm going to have you extend this chart. Perfect. And with your left hand, you're going to go ahead and cover your left eye. I'm going to ask you to read. I'm going to have you read this row starting from the left and moving towards the right.
Okay. D H J B S.
Great. And what is this row starting from the right and moving towards the left?
J H D F C.
Great. And what is this letter?
E.
And what is this row starting from the left and moving to the right?
O L C F.
And what is this color?
Green.
And what is this color?
Red.
Great. Now we're going to swap hand and eye. Great. I'm going to have you read this row starting from the left and moving towards the right.
L T F P H.
Great. I'm going to have you read this row starting from the right and moving towards the left.
H P F.
And what is this letter?
T.
What is this letter?
L.
I'm going to have you read this row starting from the left and moving towards the right.
C F D H J.
And what color is this?
Red.
What color is this?
Green.
Great. I'm going to set this to the side for now. I'm going to go ahead and conduct a test to see your range of motion in your eyes. I want you to keep your head still, straight, staring at me, and moving only your eyes. You're going to follow my two fingertips here, okay? Perfect. Now I'm going to go ahead and conduct a color test here. Give me 1 second to grab those tools. I'm going to have you cover your right eye, and I'm going to ask you a series of color questions. What color is this?
Yellow.
What color is this?
Blue.
What color is this?
Green.
What color is this?
Red. Pink.
Yeah, that's interchangeable. It's fine. What color is this?
Yellow.
Now I'm going to have you swap your eye. What color is this?
Kind of a yellowy orange.
What color is this?
Green.
What color is this?
Blue.
And what color is this?
Yellow.
Great. You can go ahead and lower your eye now. I'm going to go ahead and be conducting some sensory examinations on the face. So you can go ahead and close your eyes and relax. I'm going to be trailing 2 different materials over your face. One is going to be sharp and the other is dull. This is what sharp is going to feel like. Or I'm sorry, this is what dull is going to feel like. This is what sharp is going to feel like. Do you notice a difference between those 2 sensations?
Mm-hmm.
Okay, great. Go ahead and let me know which one it is that you feel.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull.
Right. We're going to be doing another similar test. Instead of sharp or dull, though, it's going to be warm or cold. This is going to be an example of what cold feels like. This is going to be warm. Do you know the difference between those 2 sensations? Yes. Great.
Cold. Cold. Warm. 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 Cold. 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 Warm. 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 Cold. 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 Warm. Warm. Cold. Cold. a similar sensory test. I'm going to be touching you on either the right side of your face, the left side of your face, or the center of your face. Just let me know which side you feel this touch on. Right, left, middle, right, right, middle, left, left, middle, left, left, right, right, middle, left, right, 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 left, middle, left, right, left, right, middle, 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 left, right. Okay, hopefully. Now I'm going to go ahead and gently percuss with my hammer along the bones of the face, just to make sure structurally everything is responding as it should. It shouldn't be too uncomfortable. It should be fairly relaxing, but go ahead and just close your eyes and let me know if you have any discomfort. Everything is responding as it should. I'm going to check for some facial symmetry now. Go ahead and relax. I'm just going to be measuring different parts of the face. Alrighty, Elizabeth. I have everything that we've recorded during our visit today. It doesn't seem like nothing was raising any red flags. There's nothing majorly concerning that I noticed. You basically passed all the tests with flying colors, which is a really good sign for any more serious complications. We do want to get to the bottom of your dizziness though, so I am going to go ahead and refer you some pills in the meantime, but I'm going to have you schedule another appointment to do some more thorough testing in around a week.
Okay, that sounds great. Thank you so much.
Of course, in the meantime, just make sure you're getting a lot of rest.
Okay, I will do that. Thank you.
Thank you so much for coming in today,
Yeah.
and I will see you next week.
Okay, see you then.
Thank you. Hi, Katie. Welcome in today.
Hi.
Thank you so much for coming in. I'm glad to see you. I know you've been having a little bit of ear pain. Why don't you tell me a little bit about that?
So it's been mostly in my right ear here. I just feel ringing in my ear. I'm a new driver. I just started driving, and last week I had a day where I drove like 6 hours on the expressway.
Oh, wow.
And so I just got really, really dizzy the day after. The dizziness is starting to go away, but I just get this persistent like ringing in my ear, like this fluid. And I don't know if it's from like the shock of driving or what. So
Did you notice any particularly loud noises that day, or anything that was out of the ordinary besides the driving for a long period of time?
no UFOs to report. Sadly,
Did when did this happen? Was this
this
within
was
the
about
last?
a week ago, and then since then it was like I had that day where I was dizzy, and it's getting a little better, even though I'm still a little wobbly.
Do you have a vertigo sensation when you stand up suddenly?
Yes.
Okay. Is there ringing in your ear right now?
Not right now, but sometimes in the morning and at night. Yeah.
Okay, no problem. Well, I'm glad that you came in. We're here to take care of you today. I have you set up here on this elevated pillow so I can take a better look at your ear. Feel free to just close your eyes and relax.
Okay.
I'm going to be doing a little bit of poking and prodding around your ear, but it shouldn't be too uncomfortable. Definitely let me know if you'd like me to stop at any time.
I will.
Awesome. Go ahead and close your eyes and I'll go ahead and get started here. First, I'm just going to have you lift your head up. Perfect. Just going to go ahead and bring your hair up at the top of the head here. Alrighty, Miss Katie. You can go ahead and continue to relax. I'm just going to go ahead and put on this set of gloves here. Alrighty, Katie. I'm going to ask you to tilt your head a little bit to your left here. Just going to gently palpate around the ear. Do some minor pulling here. Gently feeling the area around the ear as well. Making sure that there's no signs of any physical injury or trauma. No swelling to the area around the ear. No tension in the jaw. Does this hurt at all when I'm doing this?
A little bit.
Okay. Gently pull on your hair just a tiny bit. Now I have a light. I'm going to go ahead and shine the light. Oh, actually, it looks like my light is dead. Let me go ahead and grab a different one. Sorry, I'm going to be messing. Because I can actually see the camera today, I'm going to be like trying to like adjust it a little bit.
Yeah.
Here I have a light that actually works. Go ahead and hold the light while looking into the ear canal. I'm not seeing any signs of any redness or swelling. There looks to be a tiny bit of minor inflammation. First, I'm going to go ahead and take some samples of the ear here. Go ahead and relax. I'm just going to gently scrape the inside of the ear. That's one. Take some samples from the skin around the outer ear. Gonna send this off to analysis. Make sure there's no kind of bacterial infection affecting the outer ear. Okay, and one more. Alright, perfect. We'll send that off to the lab for some analysis. Next, I'm going to go ahead and put a foaming cleanser on the ear, just in case there were any bacterial infections. use a sponge brush here to rub the cleanser into the skin of the ear. Dust off the ear. Feel free to just close your eyes and relax. Okay, Katie. Now I'm just going to gently percuss around the ear. Go ahead and close your eyes for me. Just going to gently make sure everything is sounding solid within the bone structure around the ear. Okay, lovely. Everything is sounding good so far. Now I'm going to go ahead and conduct a hearing test on you. I have two noises here. Go ahead and close your eyes for me. I have two noises here. One is a bell and the other is a rattle. I'm going to go ahead and show you how both of them sound. This is going to be the rattle, and this is the bell. Go ahead and close your eyes, and I want you to let me know if you hear the bell or the rattle. Rattle. Bell. Rattle. Bell. 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 Rattle.
Rattle.
Lovely.
Bell. Rattle. Bell. Rattle. 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 Bell.
Lovely. I'm going to go ahead and set these aside. Now I'm going to do a bit of sound therapy. Ask you to tilt your head very gently to your left. For this next bit here, you don't have to do anything. I'm just going to be monitoring some sound frequencies here, using some of the tools that I have. I'm just going to go ahead and scan the ear with this frequency gun. And I'm going to gently rattle the bell around the ear while scanning with the frequency gun. Now I'm going to try the same thing, but this time instead of the bell, I'm going to be using one of our little egg maracas. Okay. Now I am going to go ahead and continue with the sensory tests. Now we are going to be doing a sharp or dull in the area around the ear. You're going to feel one of the objects that I'm holding in my hands, press into the skin around your ear. I want you to let me know if that sensation is sharp or if it is dull. Okay. Do you recognize the difference between those two sensations?
I think so.
Okay, perfect.
Sharp.
Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Now schedule your head just a bit perfect. Dull. Dull. Sharp. Alrighty, lovely. Now we're going to do a little bit of a different sensory test than what you might be used to. I want to be able to distinguish what you hear versus what you touch using the water globe that I have here. So go ahead and close your eyes if you feel comfortable. I want you to let me know if you hear this sound or if you feel this touch. So you can go ahead and say sound or touch depending on what's happening. Sound. Touch. Perfect. Touch. Sound. Sound. Touch. Touch. Sound. 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 Touch. 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 Sound. 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 Touch. 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 Sound. 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 Touch. 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 Perfect. Alrighty, Katie. That's going to go ahead and be the start of the testing that we do today. I am very happy with how everything is looking. We are going to go ahead and send those samples back. But before you go, though, we are going to focus the next bit of this exam on some pain relief.
Okay.
So I am just going to very gently apply a little bit of a serum to your ear. Gently, just turn your head just a little bit. I'm going to dab a tiny bit of serum onto my finger here. And massage into the area surrounding the ear. just behind the ear as well. I'm going to gently pull on your ear just a little bit. If this is uncomfortable at all, just let me know. Just make sure none of that liquid got inside the ear canal. I'm going to stimulate the outer ear here by using the bristles on the sensory brush. I think I should probably take your earring out before though, so I'm just going to gently reach around. Perfect. I'm just going to angle your head a little bit this way. Go ahead and lift up your neck. I'm just going to go ahead and gently move some of the hair out of the way here. Moving them around the ear. I'm just going to redirect blood flow and sensations around here. Close your eyes and relax.
How are you feeling after our session today?
A lot better. I think the treatment really worked. I feel like a lot less dizzy right now. Really.
I know those gems really did a lot for you there.
Yeah.
Did it feel good?
I felt amazing.
Okay, perfect. Thank you so much for coming in today. I will follow up with you in a week, and I hope your ear feels better in the meantime.
Thank you.
Thank you.
Bye.
Bye. Hi, Ahmed. Welcome in. How are you doing today?
I'm okay.
What seems to be going on today?
I'm having so much pain in my back.
Okay. When did this back pain first occur?
It's been going on for about a week.
A week? Have you been taking any medication for the pain?
I tried muscle relaxants.
Okay.
I had some left from a previous injury about 6 months ago.
Okay, and how did those affect you?
You mean the medication?
Yeah.
I think it feels a little bit better, but I don't have any more medicine, so the pain
Okay.
is back.
Absolutely. And then did you have some kind of injury where this first occurred?
Well, I think I changed the mattress, and maybe that's why. Because otherwise, nothing has changed.
Okay. We're going to go ahead and take a look at your back today. What area of the back is the pain stemming from?
I would say it's right here, down in the middle.
Okay, so the base of your neck moving down? Gotcha. Okay, Matt, we're glad to have you in here today. We're going to get to the bottom of this. If you wouldn't mind just removing your shirt and facing around so I can have a look at your back.
Okay.
Okay, Matt, you can go ahead and relax. We're going to first grab your hair and move it out of our way so we can take a look at the back here. First, I'm going to begin by gently feeling the back. Doing gentle circular motions to feel the muscles just below the skin. Does this cause you pain?
No, not there.
Okay.
More in the middle of the spine.
Gotcha. Go ahead and tilt your chin towards your chest. And go ahead as far as you're able to with comfort. Going to feel vertebrae. Does this cause a bit of pinching?
Yeah.
Okay. Gently move my hammer down your spine, percussing along the vertebrae, feeling how our body reacts.
going to ask you to tilt your chin up as far as you can go, letting your head drop back. Seeing the range of motion in your head, neck. Does that stretch feel good or painful?
Painful.
Okay, you can go ahead and relax into a neutral position. Just going to gently feel around the vertebrae individually. I can definitely sense some swelling immediately right off the bat. Next, I'm just going to have a look at the skin, making sure there's no any signs of any obvious lesions. Take a closer look at her swelling here. The skin does look healthy. There is just a bit of redness, but nothing to be too concerned about. Okay. Now I'm going to go ahead and take some base measurements, comparing one half of the body to the other to target where the swelling begins and ends. You can continue to relax. Her vertebrae does seem to be very swollen, particularly around the neck area where you mentioned the pain is stemming from. I'm going to continue to measure the back using a different method this time. I'm going to go ahead and take a look at the skin now. You can continue to relax. I want to see how the skin reacts to touch. Making sure that this injury is not surface level as well. I'm just going to go ahead gently rub this comb over your skin to see how the pigmentation of the skin reacts. If it becomes red or inflamed. Okay, the skin is reacting well. It's reddening up in the areas where there is friction, which is a sign of healthy reactive skin. We're going to continue to test our sensations with a sharp or dull test for our skin. I'm going to press a different object into your skin. That object is either going to be sharp or it's going to be dull. Here's an example of what sharp will feel like. And this is an example of what dull will feel like.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. 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 Dull.
Okay. Our sensory nerves are beautifully intact, which is a wonderful sign. We're going to move along in our testing to a warm or cold sensation test. It's going to be very similar to the one that we just conducted. That object pressed into your skin is either going to be warm or it's going to be cold. Here's an example of what cold is going to feel like. And here's warm. Can you tell the difference between those two sensations?
Yes. Cold. Cold. Warm. Warm. warm, cold, 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 warm, 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 cold, cold, warm, cold, warm, cold, warm, 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 warm.
Okay, Matt. We did have a bit of difficulty telling the difference between warm and cold close to our spine, which does reflect exactly what you've been saying, that the injury does stem from the spinal vertebrae. We're going to continue to conduct a few tests just to help us get to the bottom of this. Okay, Matt. Now I'm going to conduct a left or right test. I want you to let me know if this is going to be poking you in the left side or the right side or both, or in the center.
Okay. Left, right, center, right, left, left, right, center, right, left, center, both sides, center, both sides, center, left, right, left, right, center, left, center, right.
Okay. Okay, Matt. So my conclusion so far is that the spinal vertebrae are indeed damaged. We are going to be working on healing that process. We are going to be needing to take a few more tests to really get to the bottom of what is causing the pain in your vertebrae. But for now, we are going to begin to treat that pain. I'm just going to have you keep relaxing. I'm going to use some massage oil and help soothe it into your back. It is a hot and cold pain reliever, so it will help ease the pain that is stemming from our vertebrae. Just going to slowly massage that into the vertebrae. Even though our pain is stemming from the vertebrae, it can still be helpful to relax the muscles surrounding it too. They've probably been tensed from the pain and from compensating. So a key to pain relief is going to be to relax our surrounding muscles as well. Going to do some light skin pulling as well. Bring some blood flow and circulation to the skin of the back. I'm going to be applying some cupping therapy to the skin today as well. Hoping to release the tension locked into those vertebrae. This is hurt. Now that we've relaxed the skin with our muscle massager, I'm going to go in with some cold therapy. This cold roller is sure to target the muscles that are causing you the most pain. Going to move on to some wooden tools. Go ahead and relax. with this metal gua sha. Tracing along the skin, coming out from the vertebrae, and smoothing over our muscles. Okay, Matt, you can go ahead and put on your shirt and turn around, and we're going to discuss our findings of the day. Thank you. Okay, Matt, how are you feeling after our session today?
It feels a little bit better,
Okay.
especially on the right side.
Okay.
I feel like I can feel my muscles not so tense,
Okay, that's a great sign.
relaxing.
That is a lovely sign. I'm going to go ahead and make notes of all that we discovered today. I'm going to prescribe you some more pain medicine, another muscle relaxer for your back. And I'm going to go ahead and schedule an appointment with you in 3 days so that we can run some more tests.
Thank you, doctor.
My pleasure. Thank you for coming in today, Matt. I hope you feel better soon.
Thank you.
Hi, Sydney. Welcome in today. How are you feeling?
Doing well, thank you.
I know I've heard some reports that your scalp has been bothering you lately. If you could just go ahead and tell me a little bit more about that.
Yeah, I've just been having some problems with like an itchy scalp. I think it's dry from the winter and such.
That makes sense. I feel like a lot of people experience a dry scalp this time of year. Have you tried any kind of specialized shampoo to treat this?
I use like a hydrating shampoo and I tried doing like hair oil, but I haven't really seen any results.
Okay, it's probably sourced with the skin of the scalp then, as opposed to a treatment product that could help to relieve the symptoms. That's definitely something that we can go ahead and take a look into today. When did you first start noticing this problem?
It's probably been like a week and a half, so like 10 days.
Okay. That is definitely something that we can work with today. I'm just going to go ahead and start by taking a look at the scalp. I'm just going to first ask you to lift your head up. I'm going to go ahead, fan some of your hair back here. Perfect. Go ahead and go back down. Go ahead and put on some gloves for our examination today. Easy. Just go ahead and relax. I'm just going to go ahead and run my fingers through the hair. light here to take a look at the scalp. Looking for any signs of excess irritation, any signs of any outside causes such as lice or mites. I don't see any signs of any bugs. There's no lice or any kind of mite or tick, so that's a good sign. I am noticing just some general redness, flakiness, inflammation. Just going to continue to take a look around the scalp. Make sure there's no sores or any kind of oozing. Some areas where the hair follicles look to have a minor infection, which can be caused from excessive sweatiness if you're working out a lot in the winter, or just general dryness in this winter climate right now. I'm going to just go ahead and take a look at the underside of the scalp. I'm going to go ahead and have you flip upside down so I can take a look at the base of the scalp. Alright, Sydney, is this comfortable for you?
Yes, thank you.
Okay, great. I'm just going to brush this hair a little bit to the side just so I have a little bit easier access to the scalp. I'm going to be taking a look at the scalp closer to the neck. I do see a little bit of flakage in the hair. It's definitely not uncommon this time of year, but definitely something I do want to go ahead and take a further look at. I'm going to go ahead and collect some samples just to make sure it's not anything more concerning. You can go ahead and rest easy. And we're just going to slowly scrape off some flakes with this comb and then put it into my little dish over here so that we can send it off to the lab. You can just go ahead and continue to relax. I'm going to go ahead and move to the last bit of section here, closer to the top of the skull. I'm also going to take a direct sample. I'm just going to go ahead and thread these two sticks through. through the scalp to collect any oils or any flakes. Dip in place into our test tube and send off for testing. Making sure to get all the hard to reach places as well, like the back of the ears and the harder to reach places along the scalp. I think that is definitely a good enough sample there. Just gonna go ahead and set these to the test tubes to send them off to the lab. Now I'm going to just go ahead and test the structural integrity of the hair follicles and the skull, making sure that there's no damage to the skull anywhere. I'm just going to go around and gently tap my hammer onto my 2 fingers here. It shouldn't cause you any pain or discomfort, but definitely let me know if it does. Definitely feeling structurally sound, which is definitely a good sign. I'm going to go ahead and take some measurements just to make sure everything is symmetrical on both sides as well. is measuring pretty symmetrical, which is good. I'm going to go ahead and do a sensations test on you today. So the first sensation test that we're going to be doing today is sharp or dull. I know it can be a little bit tricky to feel the difference between these on the scalp, but just do your best to make it easier to feel. I'm going to go ahead and try and do these along the part. I'm going to try and part the hair as I go, so it's a little bit easier to feel. This is what sharp is going to feel like, and this is what dull is going to feel like. Do you notice the difference between those two sensations?
Yes.
Okay, good.
Sharp.
Great.
Sharp.
Lovely.
Dull.
Great.
Dull.
Great.
Dull.
Great.
Sharp.
Perfect.
Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull.
You did really well with that, so I think which is definitely a really good sign. I'm going to be moving on to another sensory test. This one is going to be warm or cold. I have a cold surface here with me, this water globe. This is what cold is going to feel like. And this is what warm is going to feel like with my fingers here. Do you notice the difference between those two sensations?
Yes.
Okay, great. You can go ahead and begin.
Cold. Warm. Cold. Cold. Warm. 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 Cold. 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 Warm. Cold. 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 Warm. 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 Cold. 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 Warm. 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 Cold. 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 Warm. 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 Cold. Cold.
Now we're going to be doing one more sensory test. I'm going to be dragging a small brush along your scalp. I want you to let me know if you feel that sensation repeat 1 time, 2 times, or 3 times. You can just go ahead and say 1, 2, or 3. This is an example of what 1 will be like. This is an example of what 2 will be like. And this is an example of what 3 will be like. Do you notice the difference between those sensations?
Yes.
Okay, great.
1, 2, 3, 1, 1, 1, 3, 2, 1. 3, 2, 1. 2, 3.
Okay, lovely. You've definitely passed all of these with flying colors today, Sydney, which is definitely a really good sign that this isn't anything more serious. I do want to continue to do some treatments today. I'm going to have you come in for some follow-up tests in around a week. But as far as our appointment today goes, I'm going to be applying some soothing remedies to definitely alleviate some of your discomfort in the time being. You can go ahead and relax. Okay, Sydney, I do have this rosemary oil essence. This promotes hair growth as well as healthy hair maintenance. I'm going to go ahead and drop a few drops of these into the scalp. There we go. I'm going to just gently massage that in with my fingers here. I'm going to be gently soothing the hair with this sensory brush here that I've gone ahead and loaded up with some product. The intention of the product is just to soothe the itchiness that you've been experiencing and to provide some relief. our treatment for today. Thank you so much for coming in today, and I'll see you next week.